Mbagathi District Hospital is located in the heart of Nairobi, the capital of Kenya. It borders Kibera, the largest slum in East Africa, where visiting a hospital and receiving healthcare is a rare blessing. At Mbagathi, there are only 305 health workers, simply not enough to serve all the 1 million people who depend on its services. Each health worker knows that they face incredible challenges.
Patients know me as their caregiver. They know me as their advocate, their mentor, and their educator. There are so many challenges we face that we want to address on our own, but it's not always possible.
It's always the money. I have a patient in the ward, and maybe I suspect a certain diagnosis, but I cannot confirm it unless I do an investigation, and yet the patient cannot afford it. So I treat for the most probable on my list of potential diagnoses if my patient can afford the medication for those.
I thought pharmacy was the best field because it's the last stop in the treatment of a patient. I thought that was where I was best placed to help. Yet the supplies of drugs don't meet our demands, and most of the time our drugs run out. Most of my patients can't afford to buy the drugs elsewhere, but that's what we are forced to tell them to do. I come to work every morning and I send away patients without assisting them. It's not a good feeling at all.
My biggest challenge is the lack of equipment. Sometimes the doctors ordered an X-ray, but there's no X-ray machine. The ultrasound isn't there. Sometimes I don't even have sterile gloves. Simple things like that. Our colleagues become sick. They have HIV like the rest of the population. They have TB like the rest of the population. We say that we should not have stigma towards our clients. We advocate for that. We are the ones helping our patients live positively. But as health professionals, we have stigma against ourselves.
Most patients don't know they have the right to healthcare and don't expect decent treatment. As healthcare providers, I think we are to blame. We don't talk to our patients. We see them, we identify the symptom, and immediately we are writing up a prescription. I try to talk to patients, but it is difficult. According to the hospital, I should be seeing 50 patients a day. But in the casualty unit, we get hundreds coming to Mbagathi, and I have to see as many as possible in the best way that I can.
I believe it's a human right for everyone to access healthcare, whatever class you're from. It's a right for everyone to be helped. Patients have a right to receive medical care, whether or not they're able to pay for it.
In the face of these challenges, health workers at Mbagathi do not lose hope and never give up.
Sometimes I feel so tired, but I believe in doing my best. Even though there are challenges, I dispel my duties at the highest capability I can.
I will always try within my means to make sure that my patients get the best that they can get.
I want to ask my colleagues to stay and improve our own country. There is no need to go somewhere else when we can make it for ourselves here. That's the best gift we can give ourselves, to make our home comfortable.
I was taught to be a fighter. If it's a good salary that's taking us away, we can fight for a good salary here at home. If it's the poor condition of the hospital, we can fight for the improvement of what is here. These things can be done. We can do it in Kenya.